Before the check takes place, the oral health practitioner checks the patient's details and eligibility. To carry out a finger prick test, the oral health practitioner will need a blood testing meter, a cholesterol meter for cholesterol, and a glucometer or blood glucose meter for reading blood glucose levels, a single-use lancet device to prick the finger to collect a blood sample, cholesterol test strips or blood glucose test strips that are compatible for each meter, and a sharp spin so that the lancet device can be disposed of appropriately. The oral health practitioner asks the patient to wash their hands in a hand washing sink. This not only ensures that the skin is clean and dry, but warm water can also help with warming up the hands, especially if it is a cold day. The patient is reseated on the dental chair, which can be raised to help with arm position. The ideal position is that the arm is not bent at the elbow and is in a relaxed position. First, the oral health practitioner inserts the test strip into the meter to initiate a test. You can see from the display it is ready to take a reading. Next, the oral health practitioner selects the most appropriate finger. Wherever possible, use the side of the ring finger on the non-dominant hand to avoid discomfort afterwards. Here you can see the oral health practitioner removing the protective cap from the lancet and applying pressure to the chosen finger. The application of pressure to the device activates the needle inside, which in turn punctures the skin. The oral health practitioner collects a small blood sample onto the appropriate area of the test strip. The meter then calculates a reading. The oral health practitioner then asks the patient to apply pressure to the puncture site with a tissue or square of gauze. The lancet must be discarded into the sharp spin, followed by the test strip. The patient can be supported with some leaflets about the NHS health check to refer to at home and then be discharged. Let's recap on why a finger prick test may be carried out and what it involves. A finger prick test may be taken to assess blood glucose or blood cholesterol levels. The test process is essentially the same for both types of tests, using a lancet device, a test strip, and a meter device. Any data collected is communicated to the patient's GP following the NHS health check. The same policies and processes are followed in an NHS health check as they are for standard dental procedures.